Sitting hospital ward. You see a 32-year-old patient who was admitted overnight for monitoring following her arrival with chest pain and dizziness yesterday. All tests have proved negative, but she is still being monitored by ECG. You have come to do the clinical observation. Now, let's look into the task. First one says, find out about patient's overnight stay, if comfortable. Second one says, give reasons for patients being woken up early. Hospital procedure, clinical observation before ward rounds, blood pressure, temperature, oxygen level, etc. Third one says, find out if the patient's symptoms are still present, chest pain and dizziness. Fourth one says, reassure patient about her heart rate. Current ECG reading is normal, monitoring to continue, no evidence of clinical problems. Fifth one says, find out more about patient's anxiety. If discussed with doctor, any treatments, medications tried. Sixth one says, emphasize citalopram is for anxiety as well as depression. Need regular intake, minimum 4 to 6 weeks to be effective. Seventh one says, advise the patient to speak with doctor about medications, purpose of citalopram, any concerns, side effects, etc. Explore any other treatment options tried, relaxation techniques, counseling. Ninth one says, offer to provide information on relaxation techniques, handouts, websites. 10th one says, establish patient's consent to begin the clinical observations. Good morning, Mr. James. I'm John, one of the registered nurses working in this emergency department.
Good morning, nurse.
Hi, James. How are you feeling now? I hope you had a comfortable night yesterday.
Yes, nurse. I was able to sleep well. However, I'm not really happy being woken up at 6 a.m.
Mr. James, I apologize for the inconvenience. I really understand how difficult it was for you. However, the medical observation should be carried out earlier than ward rounds. That is why you had been asked to get up a little early. Let me explain you that in detail. It is a hospital procedure that the clinical observation such as blood pressure, temperature, oxygen levels have to be checked before the ward rounds. I hope you understand that.
Okay, nurse. I was unaware of that.
Okay, Mr. James. Before proceeding further, I would like to know if you are still experiencing symptoms like chest pain and dizziness.
Nurse, no. I don't have any chest pain or dizziness. However, my heart feels as it's racing.
I'm happy to hear that you don't have any chest pain and dizziness now. Try not to be worried about your heartbeat rate, because your current ECG report says that your heartbeat is normal. Moreover, I can also assure you that at present there is no evidence of clinical problems, but your condition needs to be monitored further. Is it okay with you, Mr. James?
That's okay, nurse, but I'm still anxious because I have had episodes of anxiety for the last 6 months. I think it's really worse today.
I acknowledge your worries, Mr. James. Please ventilate your feelings. You're at the right place and we all are here to support you. Okay, did you consult the doctor, or if you have tried any medication to manage your anxiety?
Yes, nurse. My doctor prescribed me with antidepressant citalopram 2 weeks ago, but I've not been taking it because I came to know that it's for depression, but I'm not depressed. Therefore, I didn't follow it.
Your thoughts are reasonable, Mr. James, but I would like to inform you that citalopram is normally used to treat depression and anxiety. For the medications to be more effective, it should be taken for at least 4 to 6 weeks. I highly recommend speaking to your relevant doctor if you have any more concerns regarding the medications. Therefore, he will explain to you everything about citalopram, such as its purpose and side effects. Is it okay with you, Mr. James?
Certainly, nurse. I was not really aware of it before. Thank you very much for explaining me more about citalopram. It's really useful. It's a good idea to have more information regarding citalopram. I will definitely meet the doctor immediately.
Good to hear that, Mr. James. I would also like to know if you have tried any other treatment options like relaxation techniques or counseling.
No, nurse. I've not tried any other treatments, but I like the sounds of relaxation.
I'm glad that you're interested in listening to relaxation sounds. The use of sound therapy can improve your mental and physical health. It can change brain function and even treat several mental health problems such as depression and anxiety. So it is a great idea. Listen to the relaxation sounds, which will certainly help you to manage your anxiety.
Sure, nurse, I will.
Okay, Mr. James, in addition to that, I can provide you with a leaflet that contains websites so that you can gain more information on relaxation techniques for anxiety management. How does it sound, Mr. James?
That's really great, nurse. Thank you.
Mr. James, do you have any more questions for me?
No, nurse. Thank you.
All right, Mr. James, can I have your consent to take your clinical observation?
Yes, nurse. You may please proceed.
Thank you for your consent. Hope I have clarified your concerns and questions. If you have any further questions, please ring the buzzer. We'll be here to assist you. Once again, I assure you that if you follow all these instructions and take the prescribed medications correctly, you will recover faster and you can return to your normal life as soon as possible. Thank you, Mr. James, for listening to me patiently. I wish you a speedy recovery.
Thank you, nurse.
Thank you, guys. Our role play ends here.